Greetings, folks. This is Scott, and you're tuning into A Woman's Place, the podcast where we break down all the policies and politics that affect the 51%. That's right, women are half the U.S. population, and Ashley and I are here to give you the facts about how today's events are affecting them. Find us on Spotify, Apple Podcasts, Amazon, YouTube, or wherever you get your podcasts. Hello, Ashley Brown.
Hello, Scott Osborne. How are you?
I'm excellent. How are you?
You know what? I am, geekily excited about our conversation today.
Oh yeah, this is a good one. Well, we're gonna make it really accessible, not just geeky, but we have some fun numbers in here today.
It is, and it's just
Geekily excited.
I am excited because it's that when all of the data keeps tying back to the same place.
Spoiler alert! Spoiler alert! The
Oh.
data is tying back. Careful there. You're gonna get to our ending. People will fast forward.
That is true. That is true. That is true. So what are we talking about?
I think though, this show is a vindication of what we started out wanting to do, was to be really factual about how policies and programs and current events affect women that people might not realize. And so we have really drilled down to get facts, regardless of what you think about some of these programs, to get some facts and to put them out there. So I'm happy about that.
I know. Yeah, no, I agree. And we are talking about the big, beautiful bill today.
We are.
Mm-hmm.
We most definitely are. And we are big and beautiful, and we're here. And actually, as many people may know, we're recording this on the 19th of June. The bill, of course, has not passed.
Mm-hmm.
It is not yet through Congress. It has not been signed into law. So we totally recognize that many changes will be made. There's a great deal of speculation about what, but we can see a lot of what is being talked about and what is being proposed. And some of the things that were proposed are significant changes to SNAP, Medicaid, and Medicare. And so this seemed like a good time to talk about those programs and how women make use of those programs, how they help, how they don't help, and take a look at women and those government programs. And then further down the line, we'll see how the bill affects them, because there's certainly some proposed changes to all three programs in that bill.
You were correct.
Yes. And but let me make just one little quick introductory statement. For those of you who might be in the Sarasota area, though you could access it anywhere, we are now broadcasting on WSLR, I'm very happy to say, our local community Sarasota Bradenton radio station, 96.5. You can look it up online. So we are delighted with that partnership, and I'm sure you'll hear more about it in the future.
We are. Thank you to WSLR.
Yes.
And
where should we start?
Well, before we start, we didn't give a moment of acknowledgement to Elizabeth Swan and a great conversation that we had, and just how much we appreciate her sharing her wisdom with us.
She has been wonderful. We have one more talk coming up, and we're very excited about that. But those three, either individually or together, really shed light on so many things. And she's such a devoted, not only is she entertaining, I haven't heard people tie in nightclubs and conception very often, not just because of the way you're thinking about nightclubs, but internal nightclubs. So she manages to do it and be factual and well-researched and really make all of us think about, wow, how could we have been so misinformed all these years? We thought we knew this stuff. So she's great that way.
Yes. Yeah. So anyhow, now on to even more exciting topics.
On to more exciting. Let's start with SNAP. SNAP is very snappy. SNAP, aka food stamps. I mean, I've known it as food stamps. I don't know exactly when it became SNAP, when it stopped doing food stamps as an acronym, but I think it's been SNAP for a while. Supplemental Nutritional Assistance Program.
Yes.
Anyway, what used to be known as food stamps. And this, as many people know, is a program, federal and state combination, as many of these are, that provides benefits for food only and some other select products. You have to use it to purchase these products for low-income families. I mean, right now, I think the cap, the eligibility is about $39,000 annual income for a family of 4. Now, when you think about where $39,000 is going to go for a family of 4, that is very, very low. Try to get a family of 4 to live on that. So we're talking very low income. There's also some low asset requirements, if I'm not mistaken. And of course, there's state variations, but that's basically who's eligible for the SNAP program. It has been around for some time as food stamps. There are now proposals to change this in the Build Back Better. I'm sorry, the big, beautiful bill.
Right.
I thought it was worth looking at who gets SNAP. Do you have any idea? Like, what's your impression? What would you think? Who gets food stamps anyway these days?
Well, and I think why it's important to think about who gets it is because this, kind of at the crux of the debate is the work portion of it. Like you need to
Mm-hmm.
be working in order to or show proof of you're looking for work. So in that estimation, you would think that these are people who are just taking advantage of the system and they have the ability to work. And so we're going to make it harder for them to get these benefits, right? That's my lens that sometimes gets put on it,
Yeah,
Scott.
there's some popular imaginations, and the work requirement probably will get pushed into the Medicaid also, is what they're thinking. But there's certainly kind of popular conceptions about who gets these public dole money. And I don't have to tell you, all it takes is one documented malfeasance or inappropriate benefits, and obviously people extrapolate from that. And as you and I both know, in any program, private or public, there's always going to be some malfeasance somewhere.
Mhm.
But basically, the program is very well done. It's interesting. Half of the recipients are children. This was really designed to be a supplemental program for families and children. Half in the US are children, and a fifth of them are elderly. So
Mhm.
that's super interesting. And one that is really on topic for us is over 60% of the households with children who receive SNAP, so food stamps receiving, have children at home, are headed by women. They're single family, single adult households headed by women. So these are women and children. That's about 60% of these households are who receive SNAP. So that's what it looks like. What's really interesting in Florida is about 25% of the Florida recipients are elderly.
Mhm. See?
And we typically think of it as women, maybe women and children, maybe people aren't working, but it's our seniors. And one thing that I saw, which really I thought was very sad, was that the statistics show, based upon the number of seniors and their income levels, that there are many who are under-enrolled, who don't get these benefits, but could be eligible. So these are very low income, low asset seniors making do on very little amounts and not getting these food stamps that they're entitled to. So, notwithstanding this image of some non-working people, and that really made me feel sad. I'll be honest with you. There's just something about that image. I really was depressing.
But I think it's really important to acknowledge the number of, and so the majority. So when you put children and seniors together, that makes up 66% of the people who are receiving this benefit in our state,
Yeah.
which kind of extrapolates nationally, but it's it's not maybe who you have pictured in your head, right?
Mm. And it's interesting because this program has been around, and again, in one shape or another, for so many years. There have been a lot of studies about the benefits, and I found some not surprising, if you think about it, benefits that, first of all, there's health. No surprise that those who are eligible for SNAP and receive it tend to be in better health because they're getting better nutrition. They
Mhm.
also tend to be in better health because it's believed that they're getting the medical care they need. Families don't have to take their scarce resources to buy food. Maybe they can take a child to a doctor. And again, they can pull this out by looking at low income families who don't get SNAP and low income families who do get SNAP and look at some health indicators. So we know this increases people's health, which I would hope many people want. So we can see it's traced to better health outcomes. It's also traced to better educational outcomes. I mean, anybody who's worked with children knows that nutrition is important. Health is so important for young children, and it really affects development in schools. So, for development of children in the school system. So, those are some of the benefits when they look at SNAP. And I hope people think about it when they're thinking about making some changes.
I do too. I do too.
Yeah. Another program, should we go on to Medicaid?
I'm like, let's just keep the
Let's
fun
keep
going.
going.
Let's keep the good
Medicaid. What
etiquette.
is Medicaid? So Medicaid is, again, state and federal financing. It's the health insurance program which provides for both medical and hospital costs for those with very low incomes and low resources. There's both an income cap and a resource cap, meaning you can't be sitting on savings. You can't have a whole bunch of money in the bank, even if your income is low. So they check to make sure that you have low income and low assets. And state levels vary, so it's a little bit hard to get a complete aggregate number, but the cap for that is about 36,000 for a family of three. Again, if you do some quick math on that, what that means per month, and think about things like your housing and your medical and your food costs, and ask how a family of three can possibly manage. So we are talking about pretty low income families. It's significantly below what is considered the federal poverty line. In the US, there's 70 million people who get Medicaid. This is people with disabilities, it's children, it's the elderly. Also, of importance to Florida, about half of it go to the elderly and disabled. So Medicaid is really what pays for so many of our long-term care facilities, including the elderly and the nursing homes and the assisted livings, which are not only in Florida, but all over. So Medicaid covers a lot of that kind of services to the elderly. So again, we're getting another thing which isn't just younger people and disabled, which is legitimate, but also the elderly. And I think people don't always think about that angle.
Well, and the other piece of it is the healthcare for children and maternity care
Yes,
with
yes,
women.
yes.
It's
So I read also that Medicaid accounts for 75% of publicly funded family planning and 41% of births in the US in 2022. So clearly there's a lot of maternal care that women, families do not have the resources to cover. We know that if they don't have employer covered insurance at some point, maternity care is not likely to be covered. So Medicaid is often what is used to cover those costs. I don't know how much you know
and
about,
oh,
yeah.
sorry.
No, the nursing homes here, but go ahead.
Well, let's finish that because I kind of want to transition into one of the unintended consequences, which is
Sure.
loss of job opportunities for people.
Oh, interesting.
I know. So do you want to finish the long-term care?
No, go ahead. Go ahead. I want to hear this.
So we talk about the unintended consequences that you don't think through, but if Medicaid is reduced, the number of services that are available are reduced, the need for thinking about who has these jobs, namely women, CNA workers, healthcare workers, those types of jobs could be impacted as well. So it's, as so many things are, it's not just about the thing, it's about what comes as a result of it as well.
Interesting. And I mean, I don't want to say I love it, but I find it fascinating that so many of these things are circling around women, and not just because women are sort of out there to get public benefits, but because for all kinds of reasons we know, and we can talk about more, they're far more likely to have had low income streams throughout life, therefore have lower savings, therefore need therefore need public assistance in nursing homes in their declining years. Women we know live much longer through no fault of their own. Women live longer than men, which is why when you have especially the over 85 population is heavily reliant on these kind of public resources. So those are the women that we are talking about who are getting so many of these resources, and typically they have nowhere else to turn. There really is no other support system of last resort for many of those women. In Florida, there's 4 million people alone on Medicaid. I don't know if a million figure or 4 million figure means much to people, but 60% of residents in nursing homes use Medicaid. So every time you're driving past one or see one or think about one, or perhaps think about the elderly in your family, that is the dominant source of funding for nursing home care. That's our model in the US. So it's a little uncertain where Medicaid cuts will come from. I do know that they're looking at changing work requirements, obviously not for the elderly. They'll have to create some exceptions there, but I
Well,
sort of
you
feel like
say
cuts have to come from somewhere.
you say obviously,
Well,
but is
is that true?
anything,
Maybe it's not true.
I mean, right? Is anything obvious anymore? So yeah, I think it's I think this is one of those situations that having the facts, understanding who's impacted and what the the downstream impacts are important to be thinking about and encourage those who are voting on it to be thinking about. Because it's really easy to get people riled up emotionally. We talk about this too. So when you get the emotional picture going in your brain, that's why I love talking about the realities of what is the impact and the things that we need to be talking about now versus having to deal with the fallout of not taking it into account.
And I mean, we could get into the philosophy of how important is it for us as a society to feel that we're taking care of our elderly in some reasonably humane, healthy fashion. And if we cease to say that that's important to us, how does that make us feel as individuals, as a society? I mean, I think about those things that we are phenomenally wealthy country. Budget allocations will go to other places. We continue to have a huge budget. So if we really feel that is not a priority for us, what does that say about us as a nation? And how are we going to feel about ourselves as individuals? But did you have
Um,
some information about, you talked to me one day about elderly going back to work
mhm.
often when they're low income. Do you see that more? I mean, have you bumped into that?
We have, and it's interesting. There's a great series of articles happening right now specific to elderly and economic security and housing and the affordable
Mhm.
housing.
Yep.
And I I kind of use the 2008 time period when we had the recession of 2008 and the economic downturn, but we hit a peak and then we started rebuilding and rebounding. And I
After
think,
that recession, right?
right. So, and, came back stronger, jobs, um, the economy, all of it. But since COVID, things have just continued on an upward trend of increased cost. And when you blend COVID, hurricanes, property insurance, all of it, when you look at somebody who's living on a fixed income, which we'll talk through some of those opportunities and who's struggling more, and their budget changes drastically because of basic cost of living or your property insurance doubles or triples and you're in a HOA and then your quarterly fees go up or monthly fees, then you're at the age of 70, 75, thinking I've got to get a part-time job to supplement my income. And we have more seniors figuring out how to live, who to live with. Do they need roommates? Are they moving in with children? So there's big impacts there.
That's huge, and it relates to housing, which I think we're going to come back to on another show. But and if you don't know this, forgive me because this is unplanned. What kind of jobs are there for seniors now in their 70s, for example? I mean, what does this look like?
One of the biggest opportunities we have is helping them with their digital literacy skills, computer
Oh, of
skills.
course.
Because if
Sure.
you think about if you've been out of the job market for 10 years,
Yep.
think about what has changed in everything with
Sure.
technology and the computer programs and can you intuitively learn and use? So really customer service type jobs or a big one, the security guard that's in communities sitting in the little, the gated
Yes.
communities of letting people in. That's been one. Working with customer service front desk at doctor's offices, insurance offices, those types of things.
Mhm.
Because working at Publix, you have to be on your feet. Publix or a
Physical.
Walmart or a fill in the
Yeah.
blank of the service industry, you're on your feet. It's more physical. You have to take into account those things. So it's an opportunity for people if they want to have additional income. How are they finding that matches with their physical limitations and some of their workability skills.
Yeah. And if you don't have subject matter expertise in an area that you can parlay your customer service, and of course, the
Right.
digital, I hadn't thought of it. It makes perfect sense. That has just changed so fast. And
Yes.
that can be hard for people to learn. Well,
Yeah,
thank you. Not to
for sure.
digress too much, but
Yeah.
that will be an interesting one to come back to.
Yeah.
Should we take a moment on Medicare while we're on
Uh,
our three big government programs?
yes. Yeah. So we're still the
So
beautiful bill.
it is a big, beautiful bill. So we don't know what it will end up with. And the administration has consistently promised that they would not reduce Medicare benefits, but we are hearing and seeing some changes, and the House passed bills so far, as of today, would make some regulations that make it harder for people to enroll in what are called Medicare savings programs, which lower some premiums and out-of-pocket costs. And for those who are not familiar, Medicare is, of course, the health insurance program for the over 65 population. And this is not a means tested. All income levels can participate in Medicare. There are different costs. It is not totally free. It does not cover everything. There are also out-of-pocket costs. There are premiums. For most people, there are either supplements or an advantage plan. So by some standards, it's a complicated scene, but it is available for all over 65 Americans. Interestingly, and what probably will not surprise you, is over 65, 55% of participants are women. So
Mhm.
we're a little more than half right there. And that's partly because many men are still likely to be on some employer provided benefit, which you
Mhm.
can keep. Over age 85, 63% of Medicare recipients are women. So again, we see that women are aging, are living longer
Longer.
and are much less likely to have the kind of employer premiums that one might want to maintain as opposed to Medicare. So we know this has a disproportionate impact on women. Um, we will see what happens if premiums are increased, if the ability to enroll in Medicare savings plan to reduce. Some estimates have looked at what costs might be. And let's see, I have the estimated costs here from 3 to 8,000 per year. So
Mhm.
for many people of limited incomes, the elderly, 3 or 8,000 a year, it doesn't exist. They don't have that to draw on. They just don't have an extra 5,000 sitting around for medical costs if some of these changes go through. So
Yeah.
that's what we will be watching. And again, we know it's much more likely to affect women because they live longer. And of course, they're much more economically insecure than older men. Women are statistically more economically insecure. I know we have some data from the AAUW, the American Association of University Women, which has been really fantastic about looking at some of these issues and providing some very well documented data about the situation for women.
Well, in talking about the estimates of $3,000 to $8,000 a year, the the report that you just referenced too is when you look at the median annual income for women, it's 28,846, so a little under 29,000, and for men, it's just above $35,000 a year. So when you even to put into context for people, like, okay, it's $3,000 a year, what's the big deal? When you're only making, you know, $28,000, $29,000 a year, that's a pretty significant amount.
And think about that. If the median income for men is about 7,000 more than women,
Mhm.
say there's a retirement at 65 over the period of 10 years, that's $70,000 different. I mean, that's a lot of difference. That adds up. That's the difference in being able to pay for the homeowner's insurance or all the other necessary things.
When
Interesting.
we talk about the gender wage gap and what is the impact of that, when you look at the wage gap in retirement, that's when it
Mhm.
comes into sharp focus. That 15%
Yeah,
that we talk about annually now, and it, tweaked up closer to 20, then becomes almost 33% of a wage gap. That makes
yeah,
that difference between can I afford food or not? Can I
yeah.
afford to live by myself or not? Can't, all of those things. And again, these are building blocks on not only less security for women in their day-to-day, but the assets and the stress and all of the things that go with it. And it's important to look at what are we setting up for this next generation of women too.
And what bothers me is the systemic issues have made it so hard for women to have pay equity or asset equity. So they have more unpaid caregiving responsibilities. There's a pay gap. They need more time off, etc. So we've got systemic issues making it harder for women to have equal pay and accumulate equal assets, therefore more reliant on some of these programs. And now sort of being penalized for needing these programs. I feel like women are caught in this sort of little vice here at the moment that I'm not sure where we're going to go, but that's a little discouraging. You know, we know women have higher medical costs. That's a fascinating one. We could do a whole show on that. Why women have higher medical costs, even leaving out maternity care. There's a super interesting whole study by Deloitte about this. And even when you pull out maternity care, women have higher medical costs across the board from young age. So that's the kind of thing which over a lifetime accumulates. And now we've got elderly populations struggling and really needing some of these government benefits.
Well, and one of the things we talk about, and the care economy is in there as well, like stepping out of the workforce and not paying into your Social Security for those periods. But that's why we talk about why representation matters too. Because if you have the perspective of what some of the impacts are, the policies could be written in such a way or enforced in such a way that gives more opportunity for women caregivers to have the opportunity to build economic security, Scott. So, and
having representation who understands women's lives more. And again, I'm not at all saying that people who are not women don't understand it. They absolutely can. I understand men's lives. That's absolutely a thing. But it has been shown across countries that if you have more elected representatives who have some insights into things like caregiving responsibilities, things like the pay gap, they're more likely to bring into bear policies that reflect the population, in this case, reflect women as well as men. And in our country, I don't think we have any strata of elected officials like Congress, state legislatures, governors that's more than a third female. I mean, most of them are under a third. We really seem to have capped out at, 27, 28%. Congress, state legislatures, governors, I think they're all about that. They're pretty consistent.
The closest we get is some municipalities are at 30, 32%. So still, we're still at that, less than a third. And that's important because you're right. It makes the difference when you look at across the world.
Yeah.
When there are more women in leadership, it makes the difference. Our representation matters.
So to wrap up, we hope people will have a sense about, as they watch changes or propose changes in government programs, thinking really honestly about who it affects and who do we want it to affect. All government programs are redistributions. I get that. That's what happens in government programs. But how do we feel about some of these for our elderly, for our child population? So I think people should really think about that deeply, think about the impact on women and about how the cumulative effect of some of these systemic issues for women really takes a toll.
Absolutely. And like we said, lots of great data, lots of things for us to think about. And we're going to include some links to the reports we talked about and encourage people to read for themselves and get more info.
We've got a lot of good reports in the show notes, and I'm sure we'll be coming back to some of these issues in different ways. So thank you, Ashley.
Always good to be with you, Scott.
Pleasure as always.
Till next time.